Welcome, Sharon. It's so wonderful to have you in studio. I'm sitting in the corner over there, Dr. Hilton Rudnick in his usual spot. And literally, we're catching you as you fly back to London. And I know you've had the most hectic trip. So I really want to thank you for squeezing us in for the podcast. Won't you start off by just giving us a brief intro? What brings you here? I know you're currently in London and your background.
Okay. I've been a psychotherapist and psychologist and trainer and supervisor for nearly 40 years. And I just reached a point where I decided to move to new pastures, which is why I went to the UK. And I really qualified in 1990 with the ITAA, which is the International Transactional Analysis Association, as a teaching and supervising transactional analyst. And so that's when I had permission to go out there and start training other people. The training for TA is quite rigorous, and it takes a very long time. It took me about 20 years to qualify, partly because there was no one in South Africa to supervise me, but apart from that. But I found TA very interesting and very stimulating, and even after 40 years, I'm still learning. There's still a lot to learn. I'm still nowhere near knowing everything that there is to know about it. And it's just blossomed and burgeoned into all kinds of different things, which makes it even more interesting. And there are more options, because it works in therapy, it works in educational systems, it works in organizations, it works in personal growth, all those kinds of things. Very useful.
And so we were really lucky to attend your course, your 2-day workshop, TA 101, and it was just packed full of information. So I can imagine what you're saying. There's so much in this field. I wonder if it wouldn't be useful to just start off by telling us a little bit about what is TA, Transactional Analysis.
Okay, a TA is really a theory of personality, of therapy, of child development, of relationships, of communication, etc. So it's relevant to absolutely everybody. It doesn't matter whether you're a lay person or a professional. And because the language that's used is so simple, it's much easier for people to understand and absorb than other theories where they use highfalutin words and things that people don't really understand. But it can also be deceptive because although the words are simple, the concepts are not. And what I like about TA is that it was the first theoretical approach that I encountered, which came from what they call an I'm okay, you're okay life position. In other words, where as a therapist, you didn't talk down to your client, you didn't diagnose the client, you didn't tell them what they should be doing or decide what they needed. But in conversation with the client, you came to a kind of an agreement about what you were going to do in therapy, which is called a contract. And the contract is specified in terms of time, in terms of outcome, in terms of how the thing will work, dates, times, all that kind of stuff, cost. And so the client knows exactly what they're letting themselves in for. When you reach the end of the contract, which could be after 3 sessions, it could be after 10 sessions, could be after 20 sessions, the client has the freedom to either recontract, to continue or do something else, or to stop. And along the way, if the client is not happy with what's going on, they've got the freedom to recontract. And for me, that feels very comfortable. I like the idea that people can take responsibility for themselves and decide what they want to get out of it. And I always encourage people to confront me and to disagree with me and to ask me questions, because then they've got the freedom to say what they really think instead of trying to please me and say the right things. And so that's how I see TA. But of course, that's very simplistic.
Right.
So, Sharon, I'm wondering, before you came across TA, what informed your epistemological approach? Where did you start off as a therapist?
Okay, what happened for me was I've always wanted to do psychology, even when I was a kid. I wanted to do social work. That was the degree I wanted to go and do. My father pushed me into doing a BA degree and to become a teacher, which is what I really didn't want to do. And when I'd finished my BA, I decided to do my psychology honors. And then I joined Family Life Centre as a voluntary counselor. And I did their first year of training, and I just loved it. And one of the modules we did was TA. And it was presented by two people called Maria Gilbert and Patricia Clarkson, who at that time were actually the only people in South Africa who were doing TA. And their teaching was brilliant. And for me, it was life-changing. And that was the moment at which I decided that I wanted to become a psychologist, and this was what I was going to do.
Sure. So that had a big impact on you.
And then, so in your training then, did you come across other approaches that informed you and then switch to TA, or were you a devotee from the beginning and that was your method?
At Family Life Centre, they did do, I think, 10 modules on 10 different approaches. But TA just grabbed me. And I then decided to register for my master's degree at UNISA, where they did not do TA. But because of the way the course was structured and the timing and whatever, I had two young children. I was basically compelled to really do it through them because none of the other courses really suited me.
Right.
And so I did their course, which was in interactional therapy, which has been very useful to me, even with TA. My sole purpose was to get a degree so that I could do TA.
Right.
And that's what I did.
Okay.
So if you look at the TA and how it works, and we work in business a lot, the whole concept of playing games is really interesting to me, because in coaching, often the coachee will come in and say, I don't like playing these games in corporate environments. How can we unpack what is the concept of playing games, and is it something that one could use in coaching and help clients with that concept?
I think that looking at games can help in any context. And of course, in corporate work, games are at their worst. And in fact, if you don't learn to play the game, you can't actually be in the corporate. That's what it really boils down to. But I think that once people understand what is meant by a game, it's then easier for them to understand the process behind the game and to understand what the purpose of games is, which really is so that people can get their needs met in a roundabout way without asking for them directly, which can often be very manipulative and controlling. And once people understand how the game process works, they've then got the power to interrupt that game when they're in the situation. So even though you can't stop games in an organization yourself, you can certainly learn ways of getting around them and not getting hooked into them. But that doesn't mean they're going to stop. And it doesn't mean that they're not going to harm you either, because often the people who are playing the games are looking to further their own interests in the organization by belittling other people, pushing them out, undermining them, creating all kinds of negative feelings in them so that they'll leave and leave the space open for the other person to get what they want. So it's quite a complex process, but it's certainly very useful in coaching.
So to say, I'm not going to play games, that's not possible, is it?
No, we all play games. But the whole thing about games is that we can play them at different levels. So we can play a first degree game, which is really, it sounds like a social interaction. but it's always got an underlying agenda. A second-degree game is worse in that we would be embarrassed if anybody overheard us. And a third-degree game is even worse because it leads to tragic outcomes like suicide, homicide, and going crazy. Of course, these are all very simplistic explanations that have become part of common conversation, if you like, that started right at the beginning when Eric Berne started his theory. But subsequently, more and more people have investigated these concepts, and they've expanded them and made them more complex and more user-friendly and whatever. And so a lot of the initial concepts that were introduced in TA are no longer used as they were. They've now grown. They've expanded.
I'm just trying to get my head around this, and I think that I'm trying to come up with like what would be a good example of like a typical game that is played in a corporate. So we know that there are lots of power structures in corporates. I'm the boss, you'll do what you're told or whatever it might be. But so what for you would be like a typical game that would play out is question one. And question two is, are games always negative? Can there be positive games that are played out that can actually be useful?
By definition, games are negative. Games are series of transactions with a negative outcome, either for one or both people. So that's the answer to the second question.
Right.
As far as the first question is concerned, I think one of the most common games in an organization is where people are trying to climb the corporate ladder and they set other people up to fail or to make mistakes or to get things wrong, or they do things that will facilitate people making fools of themselves or not actually showing their best, and then take pleasure in seeing them actually falling over. And that's one of the most damaging games, I think, that takes place in an organization. But once the people who are the victims, if you like, of these games recognize what's happening, it gives them more options to protect themselves, to stop the games before they start, or to stop them when they do start. But in many cases, they can't stop them.
So, if we're talking about games as always being negative or having a negative outcome, is there a component of communication that transcends games, where you're not playing a game? Is that...
Yes.
Okay. Maybe we can talk a little bit about that.
Yeah. I think one of the main explanations of games is that games are barriers to intimacy.
Mm.
And so to the degree that people play games, they cannot be intimate. Now, obviously, it's not appropriate to be intimate in an organizational setting because the people that you're interacting with are not your life partners or family. And so we have to find ways to communicate with those people that are not too intimate, but also that are not gamey. In other words, they don't damage the other people. And so that's what transactional analysis is really about. It's analyzing the interactions between people and teaching them which ego state is the most productive in a particular situation so that they can have more control.
Mm.
And the three ego states are the parent, the adult, and the child, with the parent being, and I'm using one particular model here because there are many models of ego states, but this model is called the behavioral model, where the parent ego state is behavior like being critical of someone, judging them, arguing with them, telling them what to do, dominating them, that kind of stuff, or nurturing them and being nice and caring and all of those kinds of things. And that is called the critical parent and the nurturing parent. The adult ego state is the ego state in which people are being rational and unemotional and are just talking on a content level. So it would be explanations or reading books or problem solving, that kind of stuff, which in an organizational setting ideally would be the bulk of the time. And the child ego state has got three aspects: the natural child, the adapted child, and the rebellious child. And the natural child is the part of us that's spontaneously emotional, that can laugh, that can cry, that can get scared, that can be happy, all those kinds of things. The adapted child is the one that does what they're told and, is the good little person who is obedient and follows the rules. And the rebellious child is the one that goes against the rules. Now, all of those behavior styles, because that's what they really are appropriate in certain situations and not appropriate in other situations. So there's no positive or negative judgment of those ego states. We can just look at them as being positive in this situation and negative in that one. And we need to have the full repertoire of all of them in order to be able to operate in an effective way in any situation.
Okay. So how do we know that we're in a game?
For me, the first indicator is always a physiological experience. Because when you get into a game, you get a familiar, horrible feeling inside. And it can be where, your stomach starts to feel tense, or you start hyperventilating, or you start perspiring, or you get a pain somewhere, or your neck suddenly gets stiff. We've all got different physiological responses. And that is our first indicator that we've gone into playing a game. But for people who are not familiar with that, another way of recognizing it is that we get a sense while we're busy in it that, oh no, not this again. I know where this is going. I know where it's going to end. I don't want to be here. And we actually want to remove ourselves. Then you can be sure that you're in a game. And so obviously there are ways and means of avoiding getting into games, recognizing, what is the beginning of a game, knowing what kind of outcome is likely to happen for you, because we've all got our favorite outcomes, because we've all got our favorite games and we play them over and over again. And from a Freudian point of view, this is the repetition compulsion, where we are compelled almost to play this game and to play it to its conclusion and to take the negative payoff and feel bad and blame somebody else or get angry with them or, feel some negative feeling towards them that, they've created this. But I think one of the most important things in TA is that we learn to take responsibility for ourselves. And so if you're playing a game, you're also playing it. It's not the other person who's playing it. We are both playing. You can't play a game by yourself.
So if an example of where sometimes I feel caught in a game, let's just say Jane, we'll give her the name Jane. So Jane is very much, creates this idea that she's a burden to everyone, and this victim, and the food that she cooks is terrible and everyone else is better than her. And it doesn't matter how much you tell her that she's not a burden, that it's fine, that we want to help her. She'll keep perseverating, as you mentioned, on the fact how she's embarrassed because we're doing so much for her. So how do you get out of that game, understanding this person, Jane, is never going to change?
Well, we don't know that. That's an assumption. But the thing is, what do you think Jane is looking for when she does that?
Affirmation.
I think she wants to hear, yes, that she is good enough, and it's an attention-seeking mechanism. Also, maybe it's about, well, if I say I'm bad, then you won't say I'm bad. So I'll reject myself first, and I'll say how terrible this food is first before anyone else. So it's also protecting herself from that.
Yes.
But it's also if Jane has a really low self-esteem and has always felt diminished as a person and very small as a person, that part of the conversation hooks you into confirming her life script in some way. And so she's getting a confirmation from you when she plays that game of, yes, absolutely, you're a burden, or whatever she expects from you.
Yeah, I think you've hit on a very important point, and that is that games are the purpose of one of the purposes of games is to further the script. And that's why we play the same game over and over again, because every time we play it with the same outcome, we've got more confirmation that what we believe about ourselves is true. And then that lets us off the hook, because then we don't have to succeed and we don't have to change. We can just use it as an excuse and say, well, I'm stupid, or I'm ugly, or I'm bad, or I'm fat, or I'm whatever.
Right.
And that's an excuse then for not actually doing anything in life.
So there's a payoff for Jane in feeling that small about herself and feeling that negative, because then she never has to struggle to be a different version of herself.
Exactly.
So how do we deal with Jane?
Well, the question you're asking actually is not answerable in a sentence, because it would require helping Jane unpack where all this came from. Where did she get these messages from? Why does she think she got these messages in the first place? And is it possible actually that the opposite is true, or that something else might be true? So it gives you lots of options for exploration.
But what if Jane's not the one who's working in therapy? If you just interact with Jane in your life, how do I respond if I'm unpacking it for myself and I'm becoming more self-aware?
So if you don't want to play the game.
Yes. How do I get out of that game?
Well, do you want to continue your relationship with Jane?
Yes, I do.
Okay. It's an important question, because sometimes we don't want to, and we can stop a relationship.
Yes.
But if you need to continue your relationship with her, every time she does that, you can switch to a different ego state. So instead of reassuring her and saying, don't worry, Jane, you really are fine. Your cooking's okay. And, we all like you and we like your cooking. Because that really is going into your nurturing parent and rescuing her.
Mm-hmm.
And when you rescue someone, you're engaged in a game. Because there are three roles in the playing out of a game. There's a rescuer, a persecutor, and a victim. There's always a victim. So victims will look either for a persecutor or a rescuer, or both. And the minute you don't take on either of those roles, Jane can't carry on. Mm-hmm. So if you go into your adult at that moment, and she says, I'm really a terrible cook. Say, really? Tell me more about that.
Oh, so you ask some questions.
Yeah. Why do you think that? Where did you get that information from? And so you've now changed the subject, because you're no longer trying to reassure her that she's okay. And now you're giving her the responsibility of telling you where that information came from. And if you keep doing that, eventually she'll get very frustrated and probably quite angry, which will be great. And then you can stroke her for being angry.
So ignoring is not the right approach.
What is ignoring? What role are you playing? Or
the persecutor?
Is it the persecutor?
Yes.
Because there's a passive-aggressive component.
It's punishing.
It's punishing.
It's discounting.
Right.
Ignoring someone is a big discount.
Right.
And when you discount someone, it's worse than slapping them across the face.
That's you've got to be careful of that.
I think I really wanted to ask about strokes. Why do we need strokes, and what do they mean in the TAA context?
Well, strokes actually are the basis of the motivation aspect of TA. Because theories, all theories of psychology require a motivation theory. Why would people indulge in this kind of thing that we're talking about? And the motivation for seeking strokes is survival. Because one of the things Eric Burns said very early on is that human beings they've got three basic needs: the need for stimulation, the need for recognition, and the need for structure. And stimulation means being recognized, being seen, being touched. So the first stroke that a human infant gets is touch. It gets touched by the mother, by the nurse, by the whoever, and that lets the child know that it exists. When it can start to understand language, even non-verbal kind of language like cooing and stuff like that, then it's already using recognition hunger. So it's getting recognition through listening to something or through looking at a facial expression and getting a response like that. And structure hunger is the need to structure our lives in such a way that we get enough strokes to survive. Now, some people need less and some people need more. And we all have to find out what we need and how to best get them in order to survive. And if we don't get them, we die, literally.
Is that if I need a lot of strokes, am I needy?
Well, that's a definition that people have put onto people who need a lot of strokes. But if you need a lot of strokes, then you need a lot of strokes. So what?
Interesting. I mean, when we describe the ego states of Eric Berne, I mean, you can't help but be reminded of the ego states of Freud and the ego, the id and the superego.
Yeah.
And I know that Eric Berne was a psychoanalyst. I know he didn't finish his psychoanalytic accreditation, and then he started his own school. But the psychoanalytic paradigm is very deterministic. And even the drives, I guess, in some way we're talking about, that kind of put you on a path from infancy that is hard to shift. But I know that the Eric Berne transactional analysis is probably less rigid than that. And I think that there's more opportunity for changing behaviors. They both seem to be based on getting insight as a vehicle for change, right? So once you have understood something, that offers you an opportunity to change behavior. But I guess my question after that long preamble is, how do you understand the relationship between transactional analysis and psychoanalysis?
Okay. Well, I'll start at the end.
Okay.
Because, in fact, when Eric Berne created his ego states, the way he diagrammed it was he put the superego at the top in a circle, then he had a big circle with the parent, adult, and child in it, and then another circle at the bottom with the id.
Right.
And those three ego states are states of the ego, not the superego or the id.
Right.
And he said it wasn't necessary to have a superego or an id, because in actual fact, if you work with the ego states, it's all there. So that's number one. Number two, one of the first things that Eric Berne said is that change is possible. So he didn't take a deterministic view at all. His view was everybody has the capacity to change. And one of the things that he did was he tried in every session that he had with the client to cure that client in one session. That was the goal that he went into every session with. Obviously, he didn't succeed all the time, but that was how he saw it. And his belief was that if the client can get an understanding of what's going on, they then have the option to change, which of course is very similar to what CBT does. And the early TA theory was very similar to CBT. But since then it's evolved.
Right.
And so now it's no longer just behaviorally orientated. In 1979, someone called Richard Erskine introduced the racket system, which is now called the script system. And that is a very intrapsychic model, which was brought into the basics of TA theory so that it could move from a cognitive behavioral theory to a fully integrative theory. And as a result of that model, he then integrated a lot of other theories into TA. So that you got Gestalt theory, which worked with the emotions, and you got rational emotive and behavioral therapy, which worked with behavior, and you got the visualization type of therapies, which worked on the fantasies, which were part of behavior, and you had the physiological therapists who did body work that were also integrated into TA in terms of, you know, what happens in the body when you're in your parent ego state, your child or your adult. How does the body look different? What are the cues that you pick up when you look at the person? You know, when someone walks through your door, they don't have to open their mouths. What can you already see before they've even said anything?
Right.
And so there's a lot of stuff that is so precious, because you can come from any perspective and become a transactional analyst. And in fact, I've officiated at a lot of TA exams where people come to get certified as transactional analysts. And they come from every walk of life. You know, we've got engineers and lawyers and psychologists and teachers and you name it. And each one of them brings something else to the party. And all of them have found what they need in the TA theory that will help them to be more effective in what it is that they're doing. So it's amazing stuff, you know. It's an integrative approach, basically.
Right. I mean, in some way, is TA like another set of tools that you would have in your psychotherapeutic toolbox, or is it a be-all and end-all that you can use it? I mean, so like, would you, for example, use it in clinical cases?
Absolutely.
So with like psychosis, things like that, how would it be used in that way? Or with trauma, anxiety, I mean, all those things?
You can use it for everything. TA can, you know, it's not really a theory that you can use as part of an eclectic approach where you just bring in ego states for the set. Well, I mean, you can do that, but that's not really where its value lies. For me, TA has always been the umbrella theory that I've used, as opposed to psychoanalysis or CBT or whatever. And I've integrated all those other things into it. So you can integrate psychodynamic theory into it. You can integrate behavior theory into it. Everything can, as long as what you're integrating comes from an I'm okay, you're okay life position. Because the minute you start taking the doctor-patient approach with somebody, you're no longer doing TA.
Yeah.
And so for me, the TA is the umbrella and the others are the techniques, rather than vice versa.
So what are the life positions that you were speaking about earlier?
I'm okay, you're okay. I'm okay, you're not okay. I'm not okay, you're not okay. And I'm okay and you're not okay.
And how do you, I mean, you've been very clear that everything needs to work from an I'm okay, you're okay position.
Because that's the basic principle on which TA is based, is that you cannot effectively work with somebody if you are in an I'm okay, you're not okay life position. Because then you're doing something to the patient, you're imposing your will on the patient, you're not working together with the patient, and in fact you don't even call him a patient because that already means that I'm okay and you're not okay. You actually work with the person. It's a joint venture. You know, what have you come here for? What would you like the outcome to be? How would you like to be different when it's finished? And then, what needs to change in order for that to happen? What would we see that would be different in your life? How would you look different? You know, there are lots of questions you can ask. And solution-focused therapy has actually been really valuable in terms of a technique of questioning that I've integrated into TA. I found it very, very valuable. But it really gives the client the power. You know, like if you were like that, how would things be in your life? What would be different?
Because I think when you speaking from that other position that you mentioned earlier, which is I'm okay, you're not okay, that's sort of the medical model in,
Yes,
in a way, which is I'm the expert, you've got to take my advice.
Yeah. And that doesn't work with TA. If you want to work from that model, then TA is not for you. TA is for therapists and for trainers and teachers and whatever who want to work together with other people, not to be the boss of them.
I mean, I'm intrigued with the links between TA and solution-focused therapy because their kind of ideological backgrounds, their epistemologies are quite different. So the solution focus would be much more social constructionist, that the language that we change, we negotiate a new language to kind of figure out what's a better way for you to have a narrative about something, right? So that would be a more social constructionist thing. Whereas the way I understand the transactional analysis is that you have to change your behavior rather than the languaging around it. So maybe you could clarify that for me.
No, I think TA allows you to do all of that stuff. Because what you're really doing is looking at the script system and seeing what's not working. And that's where you're going to focus in. And in order to do that, you might have to use 5 different theoretical approaches which come with different epistemologies and languages and whatever, which you can use. You can use their language or you can use any other language. Because the issue there is not so much the language or the philosophy. It's got more to do with whether this intervention is going to target that particular issue that the client wants to change.
Okay.
So how do you figure out your life script?
Well, using the script system is a very effective way of doing it. And I use it often in my sessions with clients where I go through the process of filling in. I've got a form that they fill in, which we do together. And we go round and round and round and we look at, when I believe this about myself, what do I feel? And when I feel that, what do I do? And when I do that, what is the outcome? And when that outcome happens, what do I then believe about myself? And when I believe that about myself, what do I feel? And when I feel that, what do I do? And then when I do that, what is the outcome? And so you go round and round and round the script system. And we do that internally to ourselves. And once people get the hang of that, they can carry on filling in that script system on their own and unpack all the different beliefs they have about themselves and all the feelings that result from that, which generally are what we call racket feelings, because they're not real feelings. They're things like anxiety and feeling inadequate and feeling stupid. Those are not real feelings. Those are more beliefs that we have about ourselves. And so they start to recognize that, I can see how I'm continually fulfilling this script belief that I have through going through this process. And now let's look at what needs to change in order to stop that. And the thing with a cycle is that you can stop it anywhere. So you can use any kind of therapy to break the racket system. You can use behavior therapy. You can use cognitive therapy. You can use emotional therapy. You can use visualization. You can use hypnosis and regression. You can use body therapy. You can use, whatever. Gestalt therapy. You can use any kind of therapy that's going to break the cycle.
Sharon, what do you mean when you say anxiety isn't a real feeling?
Anxiety is a behavior which covers up a real feeling. And the real feeling could be fear. It could be anger. It could be confusion. Confusion's also not a real feeling. There are only 4 basic feelings: angry, sad, happy, scared. And the variations on those themes. Everything else is an adapted feeling. And we learn all the other feelings as we grow up. And they come from our environment and depending on our upbringing and our socialization and all of those kinds of things.
So there seems to be an epidemic of anxiety disorders. It's such a common place now. You hear people saying they've been diagnosed with an anxiety disorder.
Yeah, because we're not allowed to really say what we think. And to the degree that we have to keep quiet and keep it inside, it causes a huge amount of anxiety because we get anxious that maybe it'll come out, or maybe they'll see who I really am, or maybe they'll see how stupid I am, or how inadequate I am, or how whatever my beliefs are about how ugly I am. And so in trying to put on a face for the world, there's an anxiety that helps us keep that face in place.
And is that where performance anxiety comes in?
All anxiety. Performance anxiety is just, it's just another type of anxiety where we have to perform in order to be okay. And what we try to convey to a client in TA is that you're okay exactly as you are. You don't have to do anything. You don't have to prove anything. You don't have to achieve anything. You are an okay person. But that doesn't mean that all your behavior is okay. So we can look at your behavior and see what's working for you and what isn't. And we can then work with that. But the bottom line is you're an okay person.
So in South Africa, being anxious because there may be a robbery, for example.
Yes.
I mean, it's not because I don't want to say that there's a robbery. I'm like really anxious there may be a robbery. So how does that work its way into TA?
Anxiety, as you probably know, is fear about the future. Fear is fear about now. And guilt is fear about the past. So when we feel anxious, it's because we're telling ourselves that something terrible is going to happen to us. And of course, we get a lot of confirmation of that in the environment because we hear it on the news and we hear it from our friends, and, people are getting attacked and hijacked and all sorts of things. And so that feeds into the anxiety or the fear that something's going to happen. But we can choose not to focus on that because it hasn't happened. And we don't know if it's going to happen or not. It might happen to me, it might not happen to you. Who knows? And fearing and being anxious about it doesn't stop it from happening.
So, Sharon, I wonder if I could just change tack a little bit. I mean, that was a very interesting avenue, but I want to just focus on leadership and corporate wellness. And if we were striving to have an organization that really exemplified wellness from a TA perspective, I mean, what would we be seeing in our organization that would tell us that?
You would see people all in an I'm okay, you're okay life position. In other words, people would respect each other. They would listen to each other. They would work together as a team instead of undermining and sabotaging each other. They would be able to be honest in terms of their communication with each other instead of playing games. There are a lot of the aspects of the TA 101 are the things that people do when they're not well or healthy.
Right.
And so, in order to assess what you're dealing with, you look for those kinds of things. What ego states are those people in? If they're spending most of their time in their parent or their child, chances are you're not going to have a well organization. You want people who function mainly from their adult, and the part of their child that they can function from is the free child that can have fun, that can be creative, that can connect, rather than the part of the child that can have temper tantrums and attack other people and, do nasty things and all that kind of stuff. And you would have a parent ego state in the organization that was nurturing, but not in a rescuing way. In other words, where you're not enabling people to remain helpless, but you are empowering them. And that you do from a mixture of the nurturing parent and the adult, which means there's an awareness and a consciousness of what you're doing. You don't just react.
Right.
So, I'm sure there are hundreds of other things that one could look for, but those are a few examples.
Yeah, I know. I mean, I think that they all resonate. I mean, there is a implicit hierarchy in an organization, and I guess there is in a family as well. You have real parents and real children, and so at times you do have to be in a kind of parent mode, and at times, when it's not when relationships, but where something spirals out of control, then there needs to be a disciplinary.
Yeah.
You need to be in a different kind of parent mode. But is raising consciousness enough to alert people around the kind of mode that they're in? So in other words, if you had to do a workshop in an organization and explain all the different ego states, and I mean, is that normally enough so that people can moderate their ego state behaviors more effectively?
I don't think it's enough, but I do think it's a good start. And I think that with the understanding of each one of these elements, like ego states, transactions, games, strokes, life positions, stamp collecting, all of that, as people become more aware of those things, they become more effective in their communication. But you can't just teach it to them once and then move away. There's got to be some kind of ongoing practice so that people learn not just to understand what's going on, but to practice doing things differently. And I think that's where a lot of management training courses fall down, is that they come and deliver fantastic material and then they go away.
Right.
And that the effects last for a while, and then people go back to where they were. So if you want to really use this stuff, it's got to be put forward in an ongoing way by people who know what they're doing.
Right.
And where people can actually start to see the effects of their learning and how it does actually change their relationships.
Okay.
So I think it's interesting to look at it from an internal organizational point of view, but one of the challenges we have is working with clients, because I suppose the only control we have is over ourselves. So how would you deal with a really difficult client who is just playing a lot of games, and they are your client at the end of the day? You don't really have a lot of power. You want to do business with people. Is it all around staying in the adult ego state, or?
I think it's all around contracting. Because if a client brings you into their organization, why are they bringing you in? What do they want to change? And what would that change look like? And how would the people who are involved be different? And then what is that one person willing to do from their own perspective to change that? Because if the whole responsibility rests with you to change it, you can forget about it. Nothing's going to work.
Assume that the contract is tight, but you're dealing with a personality who cancels meetings at the last minute, expects you to be there tomorrow at a certain time. Nothing is set up. It's just like very one-dimensional in terms. I don't know if I'm explaining myself properly, but just like really. You can contract as much as you want with these people, but at the end of the day, you need to do what they tell you, and that's the end of the story.
What life position are they in?
They're
Critical
okay.
parent.
They're okay. We're not okay.
Exactly.
Yeah.
And if that's where they are, then something's got to shift before you can achieve anything. Because if they're seeing you as not okay, then how do you have the power to change anything? And, I would start right there with a contract that says, we will, when we set times, we will all be there on time. When we set a place, that's where we'll meet. If we want to change that, we will give people proper notice so that everybody's needs are taken into account. And you have to include a lot of things in the contract that give you space to confront the person if they don't stick to it.
I mean, that itself is difficult because, I mean, we are like in a commercial venture, and a lot of it is pandering to the needs of clients without getting into a confrontational mode or even taking them on as an adult. So, I mean, I guess a lot of our mode is kind of hearing it, acknowledging it, and, you know, trying to meet their expectations without hurting your own business. And I mean, I think we do that fairly well, and I do think it's fairly rare that we get into those kind of missteps with clients. But it's definitely there. I mean, it's definitely there all the time, right?
I think you handle it very well, I must say. But it's a challenge to not get hooked, because you can do your very, very best at giving them what they want, and for some reason they're not happy, it doesn't work out. But I do think skills for consultants are important to just recognize, even if I can just recognize what life position is this person coming from, and not to maybe take it personally. We can't always change the client. I mean, unless they're like really, really abusive or whatever, then you could step away.
You see, I think that when I talk about confrontation, I'm not talking about vicious confrontation.
Right.
You can do confrontation very gently, where you can just ask a question and say, this is confusing for me. You said this and now I'm seeing that, and I'm really wondering what's really, that kind of thing. So that is a confrontation, but it's a different kind of confrontation.
Yeah, I think you're right. I mean, I think when, on occasion before, when we've had a confrontation just on a human level, we were just saying, like, I was really surprised by the way that you spoke, and I just want to understand if I got it right or if I've disappointed you or whatever it might be. It can often bring out the person's human level rather than their authoritarian level that the position was someone in a business who's contracted with you or whatever it might be.
But I think it does go back to the games that people play that you speak about. And in a way, as the consultants, what position are we? Because we're delivering a service to the client. So you don't always go in with the I'm okay, you're okay life position.
Why not?
Well, you hope you would, but that's not how it always turns out.
Well, you see, the minute you slip out of that, you've lost control. Because I think however aggressive or disparaging or whatever the client is, if the client gets the sense that you see them as okay and that you don't judge them, they're more likely to respond to you in a different way. And that, for me, is like such a subtle skill that we have to develop. And I think to do any kind of people work, you have to develop that skill.
I mean, it sounds like you have to be a master of good communication to handle these things.
Absolutely.
I mean, even between couples, where you can often slip into some kind of destructive game where you just want to have an adult conversation, but the other person can feel negated or negative about what you're saying, and then suddenly you're just like in a destructive thing. I mean, do you work with couples to kind of enhance their communication so that they can avoid that?
Definitely. I think TA works marvelously with couples.
Right.
Because you can look at their different ego states, you can see which ego state they are in the most and how they hook into each other's ego states. You can look at their transactions and see if they're ulterior or if they're direct, and if they're being honest. You can look at what their real needs are and how they're being expressed in the relationship. I mean, there's so much that you can do with TA with couples. And I mean, my guru with couples work is Hedy Schleifer. I don't know if you know her.
Sure, we were trained by her.
And to me, she has really got it because she confronts people, but in such a beautiful, gentle, caring way that no one feels confronted by her.
She was also a master of reflection, just really able to do that so well and effortlessly.
And connection.
Yeah.
Oh, yes.
Just the way she can connect with
Yeah.
people.
Mm.
Well, it's hard to believe, but our time is up. And, just to maybe any closing thoughts from you, Hilton, Sharon?
I mean, I think it's been really insightful to share with you, Sharon. So thanks for doing it. It's definitely encouraged me to look deeper
Okay, good.
into TA. And, I think, it's amazing. Freud wrote, 40 volumes of around psychoanalysis, and Eric Berne wrote like 3 thin volumes. And it's really been a powerful, I think, it's found a powerful place in the kind of lexicon of therapy. So all credit. It's obviously a really valuable school of thought.
Well, I think that Eric Burns kick-started it, but he's had amazing disciples who've all expanded his theory. And so it wasn't,
Right.
he was actually demonstrating what he was trying to teach, that not everything had to come from him.
Right.
And it's taken a long time for TA to take its place because
Right.
it was discredited in the beginning. But yes, I think that he did start something really valuable.
Right. Okay.
And it is based on Freud's work.
Yeah.
There's no question. It doesn't negate Freudian theory at all.
Sure.
And Sharon, although you are based in the UK, you are available for sessions on Skype, if I've got you right. So we'll definitely put your details in the show notes. And thank you again for your time. It's been really interesting, and I always learn something when we have these conversations. So thank you so much.
Well, thank both of you very much for thinking about what we've been talking about and asking insightful questions.
Thank you.
I appreciate that.
Good.